The Arthrex SpeedBridge is a soft tissue fixation device that combines fully threaded SwiveLock anchors with FiberTape. Your surgeon may use the SpeedBridge for repair of a rotator cuff tear. The rotator cuff is what holds your humerus, upper arm bone, in the shoulder socket and helps to lift and rotate your arm. It is made up of 4 muscles that come together to form the rotator cuff around the head of the humerus, which fits into your shoulder socket, glenoid. First, the surgeon prepares the rotator cuff and humerus for the insertion of the first bone anchor, called a SwiveLock, by punching a bone socket. The SwiveLock is available with a ready-to-use FiberTape loop. The surgeon inserts the SwiveLock anchor into the bone and releases the FiberTape loop. The fast-pass scorpion is used to pass the FiberTape through the rotator cuff and retrieve it for use later. The step is repeated for the second anchor. The FiberTape loop is trimmed at the splice to separate the tails. The surgeon retrieves one FiberTape tail from each of the anchors and preloads the FiberTape tails into another SwiveLock anchor. The surgeon then prepares the bone socket and inserts the biocomposite SwiveLock anchor. Finally, if there is a loose end of rotator cuff, it can be secured with a fiber link and the 2 remaining FiberTape tails, with a 4th and final SwiveLock anchor. This completes the SpeedBridge repair